Have you ever wondered what it was like to have surgery before we could block pain? It's a pretty terrifying thought, and for most of human history, it was a reality. Today, we're diving into the incredible story of the invention that changed all of that, anesthesia. So here's our game plan. We're going to start in a world where surgery was basically a nightmare. Then we'll look at the first big breakthroughs that made painless operations a real thing. After that, we'll see how doctors made it safe, what it's like today, and even take a peek at what's coming next. All right, let's set the scene. First up, a world without anesthesia. And that subtitle really says it all. When surgery was a battle for survival. It was not pretty. Seriously, just try to imagine that for a second. It sounds like something out of a horror movie, right? But for centuries, this wasn't a movie. It was the only option. The pain was so unbelievable that surgery was always the absolute last resort. Yeah, terrifying doesn't even begin to cover it. Before anesthesia, an operation was a desperate, last-ditch effort. And to stop patients from moving from the pain, they were often held down or even strapped to the operating table. Get this. Surgeons back then weren't famous for being careful. They were famous for being fast. The whole point was to get it over with as quickly as possible, because a person can only endure that much shock and pain for so long. They might give you some alcohol to make you drowsy, but it did almost nothing for the pain itself. You can understand why people were absolutely terrified of hospitals. Okay, so that was the grim reality. But then a few curious scientists started experimenting, and everything started to change. This is where we get to the good part, the first breakthroughs that unlocked a painless world. So what even is anesthesia? Well, it's basically a way to put a patient into a controlled, temporary state where they can't feel pain or aren't aware of what's happening. The whole goal is to safely block the body's pain signals from ever reaching the brain. And once the ball got rolling, it moved surprisingly quickly. It started in the late 1700s with nitrous oxide. You probably know it as laughing gas. Then a huge leap forward in 1846 with the first successful surgery using ether. And just 1 year after that, chloroform was introduced. These three things completely changed the game. You know, what's funny is that laughing gas wasn't first used for medicine. It was actually entertainment. At parties, people would inhale it to feel relaxed and giggly. It wasn't until later that some clever dentists realized, hey, if this makes people feel goofy, maybe it can also make pulling teeth less painful. And they were right. But the really massive turning point came in 1846. A dentist named William Morton held a public demonstration in Boston. Imagine a room full of doctors, all watching as a surgeon removed a tumor from a patient's neck. The patient was in a deep sleep from a chemical called ether, and when he woke up, he said he hadn't felt a thing. Painless surgery was officially a reality. Suddenly, doctors had choices, but it wasn't easy. You had ether, which was much safer and had a bigger margin for error, but it was slow and had a really nasty smell. Then you had chloroform. It was way faster and easier to use. The catch? It was much more dangerous. A tiny mistake in the dose could be deadly. So doctors faced this constant, difficult choice between speed and safety. So just being able to knock people out wasn't enough. The next huge challenge was figuring out how to do it safely and reliably every single time. This was about turning a risky discovery into a trusted science. So what helped people trust anesthesia? A celebrity endorsement, basically. When Queen Victoria, probably the most famous woman in the world, used chloroform when she gave birth, it was a huge deal. People figured if it was safe enough for the Queen, it was safe enough for them. Public trust just soared. This new era also created a brand new type of doctor. See, surgery was becoming more complex, so they needed an expert whose only job was to manage the anesthesia and keep the patient safe. And that's exactly what an anesthesiologist is, a doctor who is totally focused on you while you're unconscious. You can think of this person as your personal guardian in the operating room. They choose the exact medicine and dose that's right for you. During the entire operation, they are constantly watching your heart rate, your breathing, everything. They make tiny adjustments as needed, and then they make sure you wake up safely and comfortably. It's a massive job. So that brings us to today. Anesthesia in modern medicine is a whole different world. We're talking about incredible precision, safety, and technology. Today, doctors have a whole toolbox to choose from. For a big operation, they'll use general anesthesia, which puts you completely to sleep. But for something small, like getting stitches, they can use local anesthesia. That just numbs one specific spot while you stay totally awake. And a modern operating room is packed with safety tech. There are machines tracking your heartbeat, your blood pressure, the oxygen in your blood. All of it is designed to alert the medical team instantly if anything, and I mean anything, changes even slightly. But safety is a team effort, and the patient is a key player. The most important thing you can do is follow all the instructions you're given, especially the one about not eating or drinking for several hours beforehand. That single step is so important for preventing serious problems. But guess what? The story isn't over. Scientists are always pushing the boundaries, always looking for what's next in the future of pain management. And the future is all about making things completely personalized. Imagine getting an anesthesia plan based on your own DNA, or new painkillers that aren't addictive. They're even developing computer-assisted systems for a perfect dose every time. The whole goal is a faster recovery with fewer side effects. When you think about it, the journey from a terrifying ordeal to this kind of precision medicine is just incredible. So it makes you wonder, right? What if we could one day block pain based on someone's unique DNA? The quest to make us safer and more comfortable never stops, all thanks to this amazing invention.